Okay. All right, it is 7 o'clock, so we will officially get started. Thank you everyone for joining us. My name is Sarah from the Pennsylvania Dental Association, and with us we also have Dr. Pastan from Tufts University. I believe we have a great presentation for you, and we will get started. Just have a couple of housekeeping items. This program is brought to you by the PDA New Dentist Committee, and we have a schedule, and it's about 7 to a little bit after 8 that Dr. Pastan will be talking with all of you, and then a little bit after we're going to have some time for Q&A. And then if anybody has any questions, on the right hand side of your screen there should be a questions panel that you can just be able to click down on and type it in there. And then if you have any for Dr. Pastan, we'll answer them at the end. If you also have any questions about like something not working, you can feel free to send that in there as well, and I will try to answer it to the best of my ability. And like I said, we are going to get started, and I hope we all have a great presentation.
Thank you. Thank you so much. I would like to thank you, Sarah, for beginning this webinar. And I'd also like to thank the Pennsylvania Dental Association for inviting me to speak to all of you. And it's a pleasure to be in your presence this evening, even though we are remote. So as Sarah said, my name is Dr. Christina Pastan, and I am an endodontist. I practice in Back Bay, Boston, and I'm the Director of Mind Body Wellness at Tufts University School of Dental Medicine. And I'll tell you a little bit more about my role and how that began. But as dentists, we come together for webinars and conferences to continue our education. Right? We're constantly broadening our knowledge about our profession. We want to continually learn new techniques to improve our skills and to upgrade our office technology to practice better dentistry. But my presentation tonight is about continuing your education about yourself and to open up some inquiry in learning mind-body techniques and practices to upgrade your inner technology to practice better dentistry. So my goals in my presentation this evening are to introduce mind-body practices as tools to support and enhance you as a person and as a dental professional. And so tonight we are going to identify the qualities and principles of the dental professional. We are going to recognize how mind-body practices cultivate the qualities essential to the dental professional. We will discover a new approach to professional development through self-connection, self-awareness, and self-care, and interpret the human effects of mind-body practices through guided experiences. And so, that said, this would be a really wonderful time for you to silence your phones or even put them on the floor, take them out of your sight, and use this time to relax and enjoy this presentation as a gift to yourself. So I've been teaching clinical endodontics at Tufts for the past 30 years, and it was a specific incident I experienced with a second-year endodontic resident that began my journey with this work in mind-body wellness and the development of the position that I hold. So pretty much for the last 15 years, I've been primarily working with the PG residents, and this is the 11th floor, our beautiful endodontic PG clinic. And one fall morning, one of the residents asked me if I would mentor her in her first apicoectomy the following week. And I always came into the school on Tuesday mornings. So the following Tuesday morning, I showed up and I came into this resident's operatory as she was setting up. And I came upon a woman that I had not experienced before. She was talking fast, she was moving fast. She started to articulate to me her concerns about this surgery. It was tooth number 12. The root tips were smack dab in the sinus. What happened if she perforated the sinus and she couldn't stop the bleeding? And as she is voicing all of this, instruments are flying on the floor. And I knew in that moment that I could relate to her because I once was a second-year resident doing my first apicoectomy. But being a longtime practitioner of yoga and meditation, I have evolved to be a very different woman, a very different individual, a very different mother, a very different endodontist. And so I knew what was important in that moment was to make her aware that she was not in the right frame of mind and body to be doing a surgery, let alone any dental procedure as far as I was concerned. So I pulled in a stool and I stepped out of my traditional clinical teaching, and I asked this woman if I could teach her a basic breathing technique, a technique that I practiced in yoga that I knew would calm her down. And I saw in moments of having this woman put her hand on her heart and her belly and begin to connect to her breath. I watched her whole body relax. Her breathing slowed down. She became more clear. She appeared to be more confident. She was back to baseline, if you will. And she looked at me, and in that moment, she said to me, Dr. Pastan, I think I can do this surgery now. And I said to her, I know you can do this surgery. What you're realizing is you're in the right frame of mind and body to do this surgery. So I didn't think anything of it. I also talked to her about self-regulation, how to use her breath to stay controlled and relaxed during the surgery. And yes, she did perforate the sinus, but she stayed calm, cool, and collected and managed the situation very well. And as I was saying goodbye to her and complimenting her great clinical care, she told me that I had changed her life. And I said to her, how have I changed your life? And she said, Dr. Pastan, I have struggled with anxiety my entire life, and I have found ways to overcompensate for it, to mask it. She said, you are the first dental educator that actually noticed my anxiety, called me out on it, and gave me a tool to cope. She said, you may have just taught me the most valuable tool or technique I've ever learned in dental school or my life. Well, I didn't take that comment very lightly. And as I walked to the garage, I thought, wow, this is a woman in her 7th year of dental education who had no idea that she was downward spiraling in a panic attack, have the awareness to stop and take some time to gather herself, and didn't know how to self-regulate. And the only loser in that situation truly would have been the patient, and she would not have had the confidence she did being able to control that situation. And so that said, my kids went off to boarding school, and I decided to go get professionally trained in yoga and meditation and take a passion of mine and see if I could create a program at our school to help dental students, because I thought if this one student had that issue, the whole school needed help. And I could tell you the faculty that I deal with day to day need that help too. And so I came back to the school and started talks with the administration. And 8 years ago, I became the school's first director of mind body wellness. And in our school, our students are trained in what you're going to be learning tonight in this lecture in the curriculum, so that they are learning these tools as part of their professional development. And so let's rewind to March of 2020 when COVID-19 began. And we've all experienced the impact that COVID-19 had on an already stressed profession, right? Dentistry is already stressed, and we became even more stressed through that. And in that situation, we couldn't change what was going on. We had to adapt. We had to navigate the stress of the situation. We had to carry on. And so that truly is the essence of what is mind-body professionalism. Mind-body professionalism is a term that I've coined, um, and it's truly the core of what I teach our students in the context of bringing these ancient mind-body practices into the context of developing yourself to be a better self-regulated doctor. And so mind-body professionalism is the ability to maintain mental and physical well-being to cope with the demands of our profession, to provide mindful, competent, and compassionate dentistry to patients. And so our students, faculty, and staff were extremely anxious during the return after our clinics were shut down. And so to give you a little glimpse into our dental school and share with you a clinical aspect of mind-body wellness in action, this is a short video of how we brought breathing practices into the clinic.
So when I was a dental student, we didn't have talking with the faculty before bringing the patient from the waiting room. We evolved into a situation where we're meeting with the students as a group before seeing the patients and talking about what we're going to do and thinking about what we're going to do. The pandemic has made a lot of problems more noticeable. It's created stresses that weren't there before. And the pandemic pushed this program more into the forefront. It's meeting a need that we didn't even know was there yet.
My name is Dr. Christina Pastan, and I'm the Director of Mind Body Wellness at Tufts University School of Dental Medicine. We've always implemented huddles before the clinical sessions, guided by the practice coordinators to just get everybody ready to go, answer any questions, get them focused. Returning back into the clinic in the COVID-19 pandemic has added a huge layer of stress to the clinical sessions. The procedure that the students undertake now, putting on the PPE, is lengthy, involved. It takes a lot of patience for the students to do this. During the pandemic shutdown, I trained all of the PCs on how to give a simple 60 to 90 second standing meditation.
So mainly the students feel a lot of pressure once they've seen patients on a regular basis. So we knew that for them being out for that long and not seeing patients for around 3 months, there will be more stress than ever.
You know you're going to be putting on all this gear. It's not the most comfortable. So even though it is only a minute, you know, that minute kind of brings you through your whole appointment, which is up to 2 hours. So it's definitely very helpful.
This breathing exercise with the students have been a great way for them to kind of like release the stress right before clinic. Having a structured time in our schedule before we actually start seeing patients has been really helpful and beneficial, just to know that that few minutes is allotted to specifically just meditating and clearing my head before the procedure.
When we take that time in the huddle, it protects us from being reactive to the stresses around us.
You can see the sense of calm as the students are standing in a group and they're taking their breaths and they're feeling the ground beneath their feet.
At first I was a little skeptical, but I've become very much a believer because it's helping me to feel a little bit more centered and focused when there's moments of anxiety.
I feel like this exercise actually helped me as well as the students to have a little bit more like center whenever I'm doing the huddle as well. So for me as a PC, I think it helps me and it helps the students as well.
So I want to say thank you to Dr. Pastan for helping to train me and my colleagues. I think it's a great advantage for Tufts.
I'm very proud of the work we're doing at our school, and for my collaboration with Dr. Andrea Zandona, the Director of Comprehensive Care. And we've been recognized nationally by the American Dental Education Association for this innovative way to decrease anxiety in the clinical setting. And I'm hoping that before the end of our time together, that maybe some of the things that you'll be learning this evening, you could consider implementing for a minute, 90 seconds into your huddle in the morning or in your back office before you begin your day. So we may be the first dental school to support the addition of mind-body wellness in the dental school curriculum, but the notion of dentists being of sound mind and body is not new. When we go back to the American Dental Association's first code of ethics written in 1866, it states that the dentist should be temperate in all things, keeping mind and body in the best possible health, that his or her patients may have the benefit of that clearness of judgment and skill, which is their right. Now, I don't know if the person who wrote this back in 1866 was thinking about mind-body practices, but the standard in their code was supporting the dentist's responsibility to be of sound mind and sound body, to execute self-regulation, not only for themselves, but for the care of their patients. And that is truly what my resident was absolutely not embodying in that moment that started me on this journey. So let's define self-regulation. Self-regulation is the ability to monitor and control our own behavior, emotions, and thoughts, and alter them in accordance with the situation. And as dentists, all of you know, we are constantly doing this. Right? We are in extremely demanding situations. We're faced throughout the day with all kinds of stresses, whether they be with the procedures we're doing, whether staff issues going on, just human to human interaction with patients that might not be so easy. So what does being a self-regulated dentist mean? Being self-regulated or being a self-regulated, grounded professional means being composed. It means having our personal philosophy, values, and spirit in alignment. It also means relaxing in the flow while understanding and communicating with others around us, especially our patients and our staff. And we're constantly trying to embody all of these qualities, many times amidst a stressful day. And so not only are we dealing with all of this in our lives, right, in our professional lives, we're dealing with all of this in our personal lives. And so life can often feel as though we are living life through a static TV. We're trying to see clear pictures, hear clear words through a life filled with static. And so to remove that static, we have to make a true effort, and we need to make some personal adjustments to remove that static from our lives or remove ourselves from the static. And so everywhere we go now, right? The bank, waiting rooms, right? Technology is around us, right? Waiting to get your car serviced. You just can't get away from screens and TV and stimulation. And so it's very hard to consciously be in the present moment unless you're really making that effort. And so sadly, we're becoming a society that's losing connection to ourselves as human beings and often to the natural, beautiful world that we live in. So we're not going to be able to change the world we live in. And one of my favorite books, maybe some of you have read it, Man's Search for Meaning by Viktor Frankl. One of his notable quotes in the book says, "When we are no longer able to change a situation, we are challenged to change ourselves." And so this quote is it's an offering to provoke self-inquiry, to challenge yourselves, and to make whatever adjustments you need to change yourselves, to make the static-filled picture on that screen in your lives clearer. And so, like this slide shows, a spinning top at high speed around its center, it can be a very valuable tool to find our center amidst the revolving, fast-paced world around us, which can first and foremost offer us connection to ourselves as human beings, and then second, grounding in the crazy world around us. And so I am going to guide us now in our first experience of a centering. And a centering is what I like to refer to as a mind-body call to order. And so I'm going to invite you to get comfortable in your seat and feel your feet planted into the floor beneath you, your sits bones rooted in your chairs. And place one hand on the heart and one hand on the belly and connect with the physical body. Eyes can be soft gaze to the earth, or you can close them if it feels comfortable. And just sense what the body's feeling this evening. Just scan the body from head to toe. And now with this connection to body, shift your awareness now to your breath. And simply just feel the breath coming in and out of the body. Feeling how the body moves with every inhale and exhale, the rise and fall of the chest. And now notice the state of your mind. And if your mind is not in this room that you're in or in this space, with every exhale, feel the mind being tethered in and aligning with the body and the breath, feeling that sense of presence with mind, body, and breath. And now just notice what your energetic spirit feels like. Is it calm? Is it anxious? Is it relaxed? Feeling this centering, this feeling of grounding of body, breath, mind, and being. And as I ring my chime, slowly open your eyes, integrating back, and just noticing how you feel. And so now that you're back and just taking that moment of pause to maybe connect with what may have shifted for you, or the difference of how you might have been feeling before a exercise like that. What you all just did in that moment was practice yoga. And you might be wondering, what is she talking about? We weren't on the floor. We weren't in Lululemon. We're not moving our bodies on a mat. The word yoga in Sanskrit, when we translate it, means to use. It means use, and that translated means to yoke or to union. And so when I think of the word yoke, what comes to mind is the visual of yoking two oxen. So a yoke is a stable gear that joins two oxen together to work as a team. And so whenever we join forces with anything, whenever we collaborate, whenever we cooperate, we get a more powerful result. And so when we yoke or join or connect our given human forces, our body, our breath, our mind, and our spirit, we as humans can experience a more powerful self, mentally and physically and soulfully. And so when I think back to my student, when she had mentioned that, she felt that she had learned a valuable tool to mitigate her anxiety, bringing her through a breath practice, just having this moment to gather herself, gave her a much better ability to be able to self-regulate and stay calm, cool, and collected through a difficult procedure. And we can use these tools and we can adapt these tools to be whatever we want them to be. And so I often say to my students, I can't make any of you yogis, I can't make any of you endodontists. But what I can do is expose you and try these tools and these practices, and then you can make them your own. And so yoga is a multi-limbed path that can be narrowed down to a four-limbed path that can serve as the building blocks to mind-body professionalism, beginning with ethical grounding, then practicing proper breathing, living with mindfulness, awareness, and presence, and then self-care by restoring the body through incorporating simple stretches into the day. And so we're going to take a close look at these practices and how they can be supportive tools in mitigating personal and professional stress. But first, let's learn a little bit about what science says about yoga and its overall impact. Well, a group of researchers out of the Brigham and Women's Hospital and Mass General Hospitals in Boston, along with scientists from the University of Connecticut in the Kripalu Center for Yoga and Health, where I have done all my training. This team looked at how yoga, not just as a form of physical practice, but also at its historical perspective of this multi-limbed path, and how it can help enhance well-being and how it can be a tool for stress management. And they published their findings. And basically what they found was that their research suggests that yoga provides both top-down and bottom-up tools that work together to lower stress, manage stress, and improve overall mental and physical health. And so top-down tools impact the mind directly and then have a trickle-down effect on the body and behavior by reducing the amount of mental and physical strain and improve our ability to manage emotions and increase self-compassion. And bottom-up tools that yoga also offers impacts the physiology of the body and improves the function of the vagus nerve. So with posture practice and breathing practice, we impact the body and our physiology directly. And so when we engage in these practices, it sends a message to the mind that it's okay to relax. And so practicing yoga improves the function of the vagus nerve, which helps us calm down and relax. And so basically what these researchers and others are illustrating is that when we move the body and are consciously breathing, it improves our ability to respond and live with stress more deliberately. So looking at this diagram, this research suggests that the practice of ethical behavior, for instance, impacts our emotions and well-being, because when we live and act from a kind, moral, and ethical place, we are happier. And when we are happier, we feel better. And so we also, with top-down tools, look at the practice of mindfulness and how it impacts the mind to stay present to different sensations, to what we're feeling, what we're thinking, and to different experiences, which can help us cope with rumination, improve our ability to manage emotions, and increase our self-compassion. And so together, these two practices provide a self-regulatory mechanism in the body that not only enhances the ability to regulate our thoughts, feelings, and emotions, but can influence our motivational drive, our goal setting, our working memory, as well as improve our attention and our awareness. And now let's look at the impact of bottom-up tools. When the body engages in breathing and posture practice, it sends a message to the brain that it's okay to relax, activating the parasympathetic nervous system to react more efficiently when exposed to stress. And so the more the body experiences these practices, it improves the tone of the vagus nerve. And so the more we do this, we create something called vagal tone. So the more we're able to regulate our breathing, as soon as we do that, after practicing it and doing it on a regular basis, the body just shifts right into it's okay to relax. And so we start training our students with this skill in year 1, and we're hopeful that by year 4, they are equipped with this vagal tone to help them move on into their practices of dentistry. Mind-body practices, specifically yoga and breathing techniques and mindfulness, are ancient practices. Their roots begin over 5,000 years ago. These are not fads. They are well established and well researched. They are gaining so much traction in the research world. There are probably hundreds and hundreds of articles now that are grounding these practices into the literature. Beyond the physical and mental component of these practices, there's also a philosophical component. And so let's just look at these first limbs of yoga, which are the ethical codes of living, or the external and internal virtues of character. So basically, they are the do's and don'ts of living. And so when the research is looking at yoga, they're not just looking at the postures on the mat. They're looking at what does yoga teach us. And so the external virtues of character: not harming, not lying, not stealing, non-greed, moral conduct. So from the yoga perspective, non-harming means honoring your body, not doing things that are going to hurt your body, listening to your body. And then the internal virtues of character: purity, contentment, self-control, and self-study. And I remember when I was learning about these, studying yoga in my yoga teacher training and thinking about these ancient restraints and observances, I thought, wow, this isn't not only how I want to live my life as a human being, but these are qualities that are essential to my responsibility as a professional, and very well documented in the American College of Dentists Professionalism and Ethics Handbook. And so when we are grounded in ethical behavior, we establish our personal values that establish our professional mindset, which positively impacts the relationships that we have with our patients, the public, our office staff, and other professionals, as well as fostering competency and making responsible ethical decisions. So what is a simple way to build on this foundation? Well, practicing gratitude. Evidence suggests that practicing gratitude may shape improved rational and economic decision making. It also shows that engaging in acts of gratitude and generosity is an effective strategy to increase our well-being. And many studies over the last decade have found that people who consciously count their blessings tend to be happier and less depressed. And so gratitude helps us move beyond toxic emotions. It makes us put things into perspective. It makes us more optimistic. And it actually reminds us to, in our busy worlds, to stop and smell the roses. And so we're going to engage in a short gratitude meditation. This again is something that, you know, in the midst of a busy day, when you know, we all have them. It hasn't even gotten to lunch yet, and we're you know, up to here with emergencies or piece of equipment that breaks down or whatever, right? We all know what I'm talking about, and things start to get to you. Just maybe taking that moment to go back into the office and just take some time to rest in gratitude can be a really powerful practice. So again, I invite you to get comfortable in your seats and place your feet, press them into the floor. And hands can gently rest on your lap. Eyes can be closed or soft gaze to the earth. And take a moment to just connect with your breath. And just feel the breath coming in and out of the body. And just letting your attention rest on breath. Feeling the movement of breath as it enters the nose and as it leaves the nose. Feeling a sense of ease in your face, in your shoulders, in your arms, your belly, and your legs. And now bring your attention to your heart center. And focus on feelings of love and compassion, empathy and forgiveness. And maybe feeling gratitude that you are able to deliver these incredible virtues in your practice. Very powerful part of being a dentist, that we can offer compassion and empathy to our patients. And maybe bringing gratitude for your ability to practice dentistry, for your hands that deliver the care to your patients, for the life that you're able to provide for yourself and to your families. Feeling gratitude for your staff, the team that supports you, supports each other, supports your patients. And now maybe bringing some attention to people who truly nourish you in your life and how they bless you with their presence. Your spouse, your children, your parents, your siblings, your friends. Feeling gratitude for the many gifts that you've been blessed with, the home that you're living in right now. And just scanning the body from head to toe and feeling grateful for your ability to see beautiful things, to hear music, to communicate your feelings, to express emotion. Your ability to walk, to feel, to dance, to go for a walk. And for the next 30 seconds, I will silence myself for you to call to mind other aspects, things, people, experiences in your life that you're grateful for. Beginning now to deepen the breath. As I ring my chime, slowly open your eyes, taking a moment to transition back into real time and just feeling sense and gratitude throughout your entire body. This is when I'm in person with an audience. I love to ask how people are feeling right now and to share with how they're feeling. But I hope that was a good experience for all of you. Gratitude is also something that you can begin your day with. Have a gratitude journal. Many people end their day with some gratitude. Again, very powerful, simple practice that can ground us. So let's move on to the next 3 practices on our mind, body, professionalism path. How can breathing, mindfulness, and yoga postures support us in the practice of dentistry? Well, yoga is a self-care mind-body practice that leads to a body that is both strong and flexible, and a mind that is alert and calm. And so we all know the dentistry's physical toll, and there is no way around the toll that dentistry takes on our bodies. And as much as we all want to practice ergonomics, let's face it, we are going to put our bodies in any contortion possible to get the job done. And so as much as we try not to hunch over our patients all day, right, we will continue to do this when we need to. And so when that happens, we're closing down our front body. We're closing the muscles on our front bodies, and it's not the most effective position for breathing. We're putting a lot of strain on our cervical vertebrae, on our necks and shoulders. We're not using the diaphragm as much to breathe when we're in that position. And so yoga opens the chest, it expands our front body, and certain postures allow for the upper back muscles to relax and relieve tension in the neck, back, and shoulders. Yoga can be very supportive for dentists in that it can improve our strength and flexibility and invite ease in the areas of our body that get taxed the most. Psychologically, we know that dentistry is mentally demanding and draining. We are in a profession where many people are scared, they're afraid to see us, and their fears are real. And they have to be treated with patience and sensitivity, which takes a lot of patience and sensitivity from ourselves. And so studies show that our patients' anxiety make it more difficult for us to treat them. It requires more time and is stressful for us as providers, and that there is evidence that the dentist experiences the same patterns of physiologic stress responses that parallel our patients' responses when we're performing dental procedures that evoke patient fear and anxiety. And I'm sure you all know what I'm talking about. And so breathing practice is a wonderful tool to keep the nervous system calm and self-regulated. So it's a very valuable valuable stress management and self-regulation tool that can provide stability in navigating challenging moments in clinical procedures and in personal interactions. And so I often ask my students, do you ever feel when you're nervous and anxious that you're not breathing, right? You're just focused so much on your dental procedure that you're not breathing. And so when we are able to do this, we're able to not just calm ourselves, but it's more calming to the patient when they can feel our sense of stress reduction. And so one of the benefits of breath, well, first of all, when we bring our attention to our breath, consciously bring our attention to breath, it's a way to connect with ourselves. It draws us into the present moment because we can only breathe in the present moment. And studies show that by changing the patterns of breathing, it's possible to restore balance to the stress response system, relax our body, lower blood pressure, increase our energy levels by getting more oxygen into the body, and then it calms an agitated mind, which can decrease symptoms of anxiety, depression, and overwhelm. And so we're constantly engaged in breathing, right? If we're not breathing, we're not alive, right? So we're breathing all day. We don't even realize we're breathing most of the time. And so we're breathing unconsciously. It's just happening. But when we engage in conscious breathing, we employ a valuable self-care tool that calms the mind and nervous system. It releases tension in the chest and abdomen where we're feeling that stress when we're hunched over. It utilizes the full capacity of the lungs. It engages the entire respiratory system. So the diaphragm, the rib cage, and the upper chest. And it puts to work the primary muscle of breathing, which is the diaphragm. And so when we inhale and inflate the belly, we bring in a nice flow of oxygen all the way up to the upper chest. The secondary muscles of breathing are the serratus anterior, the pectoralis muscles, the scalene muscles, and the sternocleidomastoid. And so often we get tension headaches, we get all this tension in our upper shoulders. And often that's because we're not using the belly to breathe. We start breathing from our chest in shallow breathing, we're taxing all these secondary muscles that are just there at the end to just lift the rib cage up at the end of that diaphragmatic breath. And so the key to regulation breath is related to the exhale. So when we make our exhales twice as long as our inhales, that's when we engage the parasympathetic nervous system. So I'm sure all of you have, you get frustrated and you sigh. And so when we sigh, we are taking a long, slow exhale. We release tension, right? We feel better when we do that. And so this diaphragmatic 3-part breath is where we take in a breath on 2, and then a long, slow exhale on a count of 4. And so I think about, what I'm teaching the students and what I, as an endodontist in stressful moments, am constantly behind my mask. Long, slow exhales, softly, so my patient can't hear them, but just continually releasing the stress with the long, slow exhale. So we are now going to engage in a breathing exercise. Just going to bring the volume up a little bit. And so again, I'm going to take you through the breathing practice that I taught my student, and that all of our students now are doing before their competencies as a group. So feet into the floor, feel rooted in your chairs. One hand will come to the heart and place one hand on the belly and press in to the physical body. Just connect with the body. Eyes can be closed or soft gaze to the earth. And take a deep breath in through the nose. Feel the belly inflate and the collarbones rise. And then a long, slow exhale on a count of 4, emptying out all the breath, feeling the belly retract to the spine. Inhale, belly inflates, ribs expand. Collarbones rise. Long, slow exhale on a count of 4. And then doing this a few more times. Big inhale, belly inflates, ribs expand, collarbones rise. Long, slow exhale, count of 4, empty the breath. And then doing that a few more times on your own. Inhaling on a count of 2. Long, slow exhale, count of 4. And as you're ready, opening your eyes. And just taking that moment of pause to just notice how you're feeling. After a few minutes of just conscious diaphragmatic 3-part breath. And so again, this is something that you could implement in your huddle. You could do this in your back office. You could do this between patients. You can do this during procedures. Something to consider. And so now we're going to move into talking about posture practice and how we as dentists can benefit by incorporating some simple posture practice into our day. These exercises can be a personal and clinical stress management tool. It can be a modality for increasing flexibility, our range of motion, that, the areas that are mostly affected by our work, our shoulders, our neck, our upper back, and in our lower back. And so we know that the stresses of the dental profession begin in dental school. And one of my favorite aspects of my work at Tufts is teaching yoga to our dental students. My passion in this work revolves around teaching our students the importance of self-care and how to restore and stretch their bodies that are getting taxed through sitting all day in their lectures or seeing their patients in the clinic. But what they are also learning through yoga is to feel comfortable in their bodies, to feel grounded in their bodies, how to breathe, how to learn lessons on the mat that they can take off the mat. And so ultimately, what I am trying to teach our students through yoga is how to connect with themselves so that they can better connect with others. And so we don't need to be on a mat or in Lululemon or doing, fancy headstands, back bends, or anything like that to experience the benefits of yoga or to practice yoga. I was trained in chair yoga by the woman who created chair yoga, a woman named Lakshmi Volkar, who's out in Los Angeles, California. And she created chair yoga because one of her students at 35 developed severe rheumatoid arthritis and was not able to get down on the mat. And the physiologic benefits of yoga are so powerful that she felt that anybody should be able to practice yoga in anywhere, in any chair. And so I felt, one of my reasons of getting trained in this was to teach dentists, teach our students these simple chair yoga postures to restore their body. This is a practice that we can do in our back offices. Again, even in the operatory, I've done them, when a patient leaves, just to kind of realign, rotate and align my spine. Musculoskeletal disorders in dentists are very high. They affect our neck, back, shoulders, hands, and wrists. And surprisingly, there have not been many studies published on this topic in our profession, but what we do know from the literature is that 62% of dentists have reported at least one musculoskeletal complaint, and 30% of dentists have reported chronic issues, and about the same percentage, 30%, have reported needing to seek medical care. And so I'm going to guide you now through a simple chair yoga sequence that you can do simply in your back office. At the end of my presentation, I will give you the link to my YouTube channel where I have videos of everything I'm presenting tonight. So if you wanted to follow along with your computer in your back office, you can. So I'm going to ask you to come to the front edge of your chair. So you are stable with your feet rooted into the earth, but not slouched back, right at the front of the chair. Press the feet into the floor. Hands can be on your lap. And let's just begin by simply rolling the shoulders up and forward. And as we do this, we're going to begin to coordinate breath with movement. So inhale, lift the shoulders, exhale, lower. And other way. And now pretending that there is a pen on your nose and there's an imaginary wall in front of you, drawing circles on that imaginary wall with your nose. And so circling the chin up, around, and over. And other way. And then bringing the head back to neutral and just rotating the head along its axis, just looking over each shoulder. And now drop the right arm down to the side and reach it up and over. So the hand takes hold of the left ear and gently draw the right shoulder to the right ear to the right shoulder. And take some deep breaths in and out. And then let that left hand drop and reach the left fingertips toward the floor. Still feeling that gentle stretch in the left side of the neck. And then releasing. Left arm will come up and over, taking hold of the right ear. Draw the left ear to the left shoulder. And then reach toward the floor with the right fingertips. And then coming back to center. Move through the 6 movements of the spine. So with your hands on your lap, just begin to rotate the upper body around the pelvis. And so just driving with the shoulders. And as you do this, feeling some release in the lower back. And other way. And then coming back to center, I'm going to come to the side. Feet will be pressed into the floor, seated cat-cow, hands on the lap. Press into the floor, lift the chest and chin, arch the back, open the heart, and then exhale, round into yourself and draw the navel to the spine, and then roll forward. Lift the chest and chin, arch the back, and then exhale, rolling into yourself, chin to chest. And let's just do that a few more times. And so this is moving spinal fluid up and down the vertebrae. It's hydrating the discs. And now we're going to rotate and align the spine, lifting the arms up to the sky. Exhale, rotate the body over to the right. Left hand's going to come on to the right knee. And the right hand is going to sweep around the back body. Press it into the chair at the base of the spine and gaze over the right shoulder. And while you're in this spinal twist, send the belly out toward the computer. Take a deep inhale. And exhale, belly retracts to spine. So bringing in that conscious 3-part breath. Inhale. Collarbones rise, empty out. And then release. Arms come up to the sky and rotate over to the other side. Right hand onto the left knee. And the left hand will press into the chair behind the base of the spine, gaze over the left shoulder. And breathe. Coming back to center. Arms will come up to the sky. press into the floor, and with the right hand, take hold of the left wrist and pull the upper body away from the pelvis. And now grounding in through the left foot so you don't topple over, begin to tip over to the right. This is seated half moon. And so grounding in through the left foot, feeling a nice stretch up the left side body, and taking that deep breath in through the diaphragm up to the collarbones. Exhale. And one more time, inhale. Exhale, come back to center and shift the grip. Pull the right arm up to the side and then arc over. And then just coming back. Inhale the arms up to the sky. And then pull down through the center line, thumbs to the chest. Take a moment of pause. And I'm just going to move us through some acupressure, body balancing hand sequences that bring vitality to our hands. And so just push the hands out toward me and make stop signs. And begin tapping right below the thumbs. And then flip the hands around and underneath the pinkies. And now tap the right wrist on the left wrist. And then the left wrist on the right. Make a fist with the right hand and pound it into the left palm. And the left into the right. And now the back of the right hand on the left. Switch. And then tapping through the webs between the thumb and pointer finger. And now between all the webs of the fingers. And as you're ready, gently bring your fingertips to lightly grace your forehead and cheeks. And just notice what you're feeling. Maybe feeling a feeling of radiant energy, vitality, a vibration. So this is releasing tension from the hands, from the body, and balancing and calming the nervous system. And then as you're ready, bringing your hands, your thumbs to your chest, and just taking a moment to check in with what you might be feeling physiologically from 7 minutes of simple yoga postures in your chair. So again, simple practices that can be easily incorporated into your day. So let's move to our last topic, mindfulness in dentistry. And so living more presently is what we call the practice of mindfulness. And this is a topic that in and of itself is its own presentation. So I'm going to try to simplify this as best as I can. Mindfulness was coined by a man named Jon Kabat-Zinn. He's a famous meditation teacher and founder of the Center for Mindfulness at UMass Medical Center. And he defines mindfulness as paying attention on purpose in the present moment, non-judgmentally. And often he likes to put in as if your life depended on it. And so mindfulness is a way of connecting with our life. And so with all of life's distractions, our minds are all over the place. And so when I say our minds are all over the place, it's because we spend so much time planning and worrying about the future and a huge amount of time hashing about the past, and the present moment gets squeezed out. It's become very underrated. And so the present moment truly is all we have. And so when we can pay attention to our mind, to our body, to the people we're with, to what we're experiencing in life, truly present, right? It's really like taking charge of our life. And it's not an easy thing to do. I mean, that's why mindfulness is a practice. And we practice it through meditation, and then we can live mindfulness. And so it's assumed that healthcare professionals naturally have the abilities and pay attention in both clinical and learning situations. However, studies show that people are only briefly and unpredictably attentive. And so out of habit, as we talked about at the beginning of this presentation, we get distracted and our attention moves to unrelated thoughts and feelings, and we can tend to zone out and become mindless. And this can happen quite unintentionally and without conscious awareness. And when that happens, errors can occur, failures in our performance can result, and the way that we treat people can be compromised. And so we are in a service profession where we are working with human beings first and foremost, and we need to be able to connect with them and to be aware of their needs and completely present with them. When we are present with ourselves and aware of our own thoughts, feelings, and emotions, we're better able to connect with others. And so mindfulness trains the mind to observe our own reactions to stress and stressful thoughts. And so when we're able to start doing that within ourselves, it spills out into the way that we react to the stresses that come along with the work we do and the different personalities that we treat. Mindfulness meditation is a form of self-care that can shut off the static, relax the body, focus and calm the mind. Just like we need to reboot our phones and our computers, we need to reboot ourselves. And this is a simple way to do that. And so how can mindfulness support us in the profession of dentistry? Well, it can be a personal and clinical stress management tool. It can be a modality for fostering acceptance and compassion for ourselves and for others. It can improve personal and professional self-awareness, and it facilitates focused presence. And so when we get into a place of being focused, aware, and present, we interact with the world very differently. We are more graceful and skillful in our actions. We are better communicators. We're better listeners. We're more patient and kind to others. And we have a better ability to pause and wait before reacting and deciding. And so everything I mentioned, I feel, are truly essential qualities that I would want in my healthcare provider, and qualities that I feel as a professional, I want my patients to feel that I am giving them. And so how do we cultivate this? Well, we don't need to get into full-on meditation practice. Some people enjoy that. Some people want to create a daily practice. I highly recommend it. It's a wonderful self-care practice, whether it's 5 minutes or 10 minutes a day. But we can practice mindfulness in just a few minutes. And so I'd like to share with you a simple 5-step tool to practice presence and to practice mindfulness. And this tool is called, what we learned at Kripalu, called breathwa, which is to breathe, relax, feel, watch, and allow. And so breathwa is the mnemonic for this. And so first step in coming practice, as I mentioned before, we can only breathe in the present moment. So just connect to breath. Come into the awareness of breath. Notice your breath. This is the anchor of mindfulness. Notice when you breathe in, there's movement. Notice that the breath arises, it passes away. It just get into the sense of what you're feeling when you breathe, feeling your vitality. And then relax. Notice what you're holding. Scan the body for areas of tightness or tension. Maybe it's tension in your shoulders. Maybe it's a clenched fist. Maybe there's tension in the jaw, the neck, the chest, the belly. And so just softening something, right, can invite softness, just not only to our breathing, but to our whole essence. And then feel. Feeling is very important. The body of sensation, or the body sensing, our body sensing is the foundation of just being alive. Maybe some of you experienced that tonight, the tingling in your fingers, the physiology, what your body was feeling after practicing gratitude, after centering, right? These sensations, when we connect to them, make us feel more present. Also, what are we feeling emotionally, right? When we can scan through the emotional energy centers of the body, right? The root of our body, our belly area, what we're feeling in our heart, right? In our throat, what are we holding and not saying, right? The area between our forehead. And so just noticing how we're feeling can bring more self-awareness and validation to our day, to our essence. And then watching, right? Can we experience all this with a curious attention, a mindful attention, a cheerful indifference, no judgment, right? Just letting ourselves be okay with whatever is happening. And so simply just witnessing your thoughts, feelings, and emotions and just letting them be what they are. And that's my last one, allowing, right? Letting whatever is happening happen. Allowing is the opposite of pushing against or trying to control. Just letting what's happening, bringing it in with compassion and non-judgment, not trying to control experiences, and not getting into that constant struggle. So our last experience tonight is going to be a simple breathwa meditation. And so before I guide you through this, I want to just explain the context of this in the dental office, right? So something's not going well. Patient is, maybe you're going to have to pull out another carpule and give another injection in the middle of the procedure. So now tension's rising, patient's complaining, now you're getting a little tense, right? First thing you're going to do is breathe. Take a deep breath and try to relax the body as you give this second injection. Then notice what you're feeling. Are you feeling frustrated? Are you feeling anxious? But notice how you're feeling and label that. And then watching what's happening to the situation, being present with the patient, being present with the staff around you, and knowing that you're doing the best that you can and allowing the situation to be what it is. You might have to give one more carpule. It is what it is. And so feeling some freedom in this tool to take control of what might be a stressful situation. So again, I'm going to invite you to get comfortable in your chairs and feel your feet rooted into the earth. Hands can rest on the lap. Eyes can be closed or soft gaze to the earth. And now bring your attention to the breath. And simply just feel the breath coming in and out of the body. And let the breath flow freely and naturally in and out. And now relax, softening the muscles in the face, the shoulders, the arms, the hands, the front body and the back body. And just scanning the body from head to toe and feeling a sense of release from any tension you might be feeling. And now opening up to the full spectrum of sensations that might be flowing through the body as you breathe and relax. And then observing this moment closely without judging, without grasping on to what's pleasant or unpleasant about this, not pushing away what's uncomfortable, welcoming it all in and allowing and accepting this experience to be exactly as it is and dropping the need to change it in any way. And now letting go of all technique and deepening the breath. As I ring my chime, slowly opening your eyes and taking that moment to integrate back into real time and noticing how you feel. I hope everybody's feeling relaxed after all of these practices this evening. I presented a lot of material for tonight, and I'd like you to just take a moment and reflect on one aspect or one tool, one practice that I presented and guided tonight that resonated with you. So I'm just going to give everybody just 30 seconds to a minute to just think about what may have resonated with you this evening. So what's important to remember is that we don't have to make big adjustments to create change. One small adjustment in our course will change our direction. And so I hope this evening you consider leaving this presentation with the goal to implement just one practice, one tool into your personal life or professional life or both, and explore what possibilities that could open in your evolving process as you're in your career of dentistry. For the past 8 years in my role as Director of Mind Body Wellness at Tufts, I have witnessed the positive effects of incorporating mind body practices into the basic science curriculum, the preclinical simulation laboratory, the patient clinic, and the impact of teaching these approaches as simple strategies to navigate the stresses of dental school and how to apply them in the practice of dentistry. And I hope tonight I have been able to share these practices with all of you. And so as we end tonight, what are some simple ways to bring mind-body practices into your personal and professional life? Well, first of all, thinking about a centering before your day, whether it's at home or in your office. Simple practice of gratitude, taking time to consciously breathe during your day, being aware of your breath when you're practicing. Make time during your day for some simple chair yoga. Bring in some mindfulness into your day, practicing the breath-wa exercise, or even bringing a 1-minute meditation or centering or just time of peace in your morning huddle, which could really impact the whole office. And of course, making time for your own self-care and encouraging your staff to do so as well. So I mentioned that I would share with you, I have a YouTube channel that has playlists of my chair yoga sequences of all different lengths and meditations and videos that you can access. And you can also find me. My email is listed here, and also my YouTube channel, and I'm also on Facebook on my website. And I welcome at this time any questions.
We did have a question earlier that went with when you were breathing in for 2 seconds and then breathing out for 4 seconds. And the question was, does exhaling on the count of 4 mean holding the breath for 4 seconds and then exhaling, or are you exhaling for 4 seconds?
So when we take an inhale, the body naturally takes a pause. So taking in an inhale, the body pauses, and then that long, slow exhale on a count of 4 as if it was a sigh. So inhaling, holding the breath, and then long, slow exhale.
Believe that that's the only question that we've got. So if anybody else has any other questions, feel free to put them in the question box. And then I will be providing a email to all that attended tomorrow, and it will include her website and Dr. Pastan's YouTube channel. So if anybody would like to get it from there as well, it would be really easy to get it. So somebody says exhale for the 4 seconds total, correct? Okay.
So even to keep it simpler, making the exhales twice as long as the inhales. You know, just making that exhale long and slow and just emptying out all that breath like a long sigh.
Okay, thank you. And then we do have another question. Somebody was wondering how to keep the shoulder down when doing chair yoga. She said when she brings the ear down, she feels like her shoulder is rising to meet it, or when she's using the wrist to pull up the upper body.
So basically keeping the shoulders parallel to the floor. And, you know, as I said, we have to honor our body, right? Not all of our necks are going to go all the way down, right? So just tipping the neck, tipping the ear down to the shoulder as far as it will go before you start leaning over. And so just feeling that gentle stretch along the side of the neck is fine. It doesn't have to go that far. Can also gaze down toward your armpit, and that's another way to get the same type of stretch.
We have another question. It says, on your YouTube channel, do you have any lectures to share with staff or just yoga sessions?
Just yoga and meditations.
getting a lot of thank yous to for them answering your questions. It looks like that may be all of the questions that we have for you tonight.
Okay. Well, I thank everybody for spending Monday evening with me. And I thank you again, Sarah, and the Pennsylvania Dental Association for inviting me.
Thank you for coming. It was a very informative lecture. And like I said, I will be sending out information and resources tomorrow in an email. So nobody has any other questions? Oh, wait, hold on. There is another one that says, can they get a presentation to share with staff? This will be actually, this presentation that we did tonight will be available to members. We'll just have to get it edited and everything, but I can easily send that out to everybody that attended tonight in a separate email when it has been created. But if you have any other ways to get a presentation to share with staff, you can feel free to answer that question as well.
I am through my website. You can also reach me through my website. I have done seminars for staff. I can also do them virtually. So that's another way we could do something like that. So just can contact me.
Oh, got a couple more questions. No, there are not CE credits for this event. Somebody was just asking about your website address. Is it justyourname.com?
Yes.
Correct. And other as well, just saying thank you for answering the questions. I'll give it a couple more seconds to see if anybody has any lingering questions. All right, it doesn't look like there are any more, but if anybody thinks of any, you can certainly email her. Somebody thinks that okay, yeah. Yep. So everybody's just saying thank you. And then again, if you have questions, feel free to reach out to her, or you can reach out to me and I can pass them along to Dr. Pastan. But nobody has any more questions. I hope that everybody has a great rest of your evening. And thank you again for presenting.
You're welcome. Thank you, Sarah.